Barry Fuchs, Medical Director of the ICU and Respiratory Care at Puck. ICUs take care of the sickest patients in the hospital. Care is complex and fast-paced. However, staff are inundated with more data than ever before and frequently distracted by loud alarms from monitors and IV pumps. This chaos explains why the more routine tasks in the ICU may be delayed or missed. Here's an example of this. This is Jack. He's a 19-year-old kid admitted with influenza pneumonia, and he landed on a breathing machine. He was kept sedated on narcotics to tolerate the breathing tube and the ventilator. When Jack fully recovers, he won't be taken off the breathing machine unless his providers turn down the vent support and the sedation to see if he's ready. If his providers get distracted or they're too busy, he will remain on the ventilator for an extra day. This is a real problem for John and his family, but it's much bigger than John. This is a national problem. There's 5% of all hospitalized patients that are housed in the ICU, but they cost the hospital 20% of their total costs. 30% to 40% of all the patients who are in the ICU remain on the breathing machine for most of their ICU stay. So how can we do a better job to coordinate ICU care to help teams recognize recovery sooner and get patients off the ventilator sooner? We collaborated with the Innovation Center and Data Science to build an ICU platform that displays real-time data in a meaningful way to facilitate clinical decision-making and to prompt timely actions. In a single view, you can see the ventilation and the sedation status of all your patients. The system will identify and highlight when a patient is ready to come off the breathing machine and be taken off sedation well before the ICU team does. It's used in preparation for rounds or during rounds by the whole team to make decisions much easier. In addition, the system screens 24/7 and sends text alerts to the care providers into the late evening and informing them when the patients are ready to wean from the ventilator or sedation. We piloted this system in the medical ICU, tested it in over 140 ventilated patients, and found that patients awoke sooner and came off the ventilator 1 day sooner. It reduced ICU length of stay by 1.2 days and hospital length of stay by 1.4 days. Implemented across the health system, this is estimated to save about $3 million. And the projected ICU capacity that will be created by the system would be equivalent to adding an additional 5 ICU beds. We are excited to implement this across the health system and expand it to include other ICU care processes. And our next focus is going to be on ARDS care, because we think that if we can improve ARDS care, we will lower mortality across the health system. Thank you.